And now let me bring you an important information that is being discussed by the government projection as well, and what perhaps medical experts are also saying. Take a look at this. As India battles coronavirus pandemic, there has been a government mathematical projection suggesting that India, with this rising cases that you can see that we have seen in the past few days, may just flatten by after mid of April towards 16th of May. 16th of May is more of a suggestive date if the lockdown stays. Now, in this government projection, there is an estimate that the growth trend will wane by 16th May, keeping in mind the doubling rate already is now reducing at about 10 days. Now, with this estimation, the government has hinted that a further extension of lockdown is on the cards, which may signify perhaps some of the precautions that we hear are being taken. Now, a similar estimation has been given, apart from India, this is by Singapore. Singapore University of Technology and Design, whose data here is claiming, it is according to that specific Singapore University of Technology data, that India may flatten its curve by around 20th May. Take a look in this similar fashion, a rising trend and then perhaps a sudden drop, much due to social distancing, precaution, testing that is being taken. But just for a medical expert view, let's now listen in to what doctors have to say on this. Dr. V. Paul telling us more on this.
लॉकडाउन का असर जो दिखना शुरू हुआ 4-5 अप्रैल से दिखना शुरू हुआ, वहाँ मैंने लाइन दिखाई है, क्योंकि उससे पहले वो असर दिखने से पहले हमें वक्त लगता है कि ट्रांसमिशन पे इफेक्ट होने के 10, 12, 14 दिन लगते हैं। तो आप देख रहे हैं कि उसके बाद स्लोइंग हुई है, और अगर आप देखें कि मैथमेटिकल मॉडल दिखाता है कि ये ऐसे फ्लैट होना शुरू हो रहा है, और आप ये भी देख रहे हैं कि अभी भी जो हमारी सेकेंड फेज है लॉकडाउन की, उसमें हम मिडिल स्टेज में हैं, और क्योंकि असर अगले 14 दिन, 15 दिन, 20 दिन भी चलेगा, तो हमारा ये असर मई के पहले से दूसरे हफ्ते तक भी दिखेगा.
So could this be a possibility really if the lockdown stays and we can see a downward curve? Now let's discuss with perhaps people who know it best. I'm joined by a very special guest today evening, Dr.Swapneil Parekh, who's not only a doctor but is also an author of the coronavirus. Dr. Parekh, thank you so much for giving us your time on India Today. What do you make of this specific projection that has come from the government? Do you also believe, according to how the healthcare system is reacting, that if the lockdown continues for another few days, we may see the flattening of curve or perhaps a downward spiral?
Firstly, thank you so much for having me on your show. It's always a pleasure to be on India Today. You'll do such fantastic reporting. I want to show you an image which is perhaps the most important graphic when it comes to flattening the curve. And this represents an image of the 1918 Spanish flu. And what you can see is there isn't just one curve, right? There are three curves. So this is what we called the three phases of the 1918 Spanish flu. Now, we don't know which curve we are on. We could be on this curve, and if we ease the lockdown too soon and we don't follow it up with milder physical distancing strategies, we could have this second curve. And then if we make the same mistake again, we could have that third curve. And that's what experts are worried about. So you have to remember that when there is a lockdown, that's a great way of temporarily slowing down the infection. But you need to follow that up with a milder, more persistent method of physical distancing. The analogy is, let's say you're falling out of a plane and you open a parachute and you suddenly start slowing down again. Your first reaction isn't, let's cut off the parachute now, I've slowed down. You know, you need to have some method of containing the infection even after the lockdown. That being said, of course, we do need to reopen a minimum viable economy. Smarter people than myself need to figure out what that minimum viable economy is and how do you best manage the difficult balance between infection control, controlling the pandemic, and preventing the country from falling into economic disaster. There are a few important things that we can do, and this is what experts have been talking about for a long time. And, you know, everyone's familiar with this flattening the curve infographic.
Yes.
But perhaps everyone isn't familiar with the other part of it. So you see, one part of it, this curve represents the pandemic that we're seeing, right? The number of confirmed cases. Line represents the healthcare system's capacity to respond. So we don't just, we need to flatten this curve, yes, but we also need to raise the line. So we also need to raise the line of the healthcare system's capacity to respond. And how do you do that? You have to expand what's known as the test, trace, treat, isolate capacities. So we need to test at an individual level, at a community level. We need to expand our treatment capacities, our supply chains, hospital beds, ventilators, lots of different medications. So there's a lot of work to be done. And we shouldn't take false solace in the fact that this curve has been flattened, because what we could see happen then is we could see a second wave.
Yes, Dr. Parekh, I want to add to that question. I like the graph that you saw. It also is about the healthcare capacity that needs to be increased. So therefore, you think that lockdown is one. Do you think even healthcare personnel could prefer an extended lockdown while their capacity is also increased and encouraged by the government?
Frankly, the government gave us the time that we needed to expand capacities. A lockdown is always a temporary measure.
Yes.
And the government did their part. They gave us the lockdown. They gave us the time to increase our capacities. And many cities have increased their capacities. Like, for example, in Mumbai, the Thackeray government has put up a massive isolation area in the NSCI dome. So I hope that other cities have also gotten ready, that we've taken the measures, because we are going to see a flattening of the curve. We are already starting to see that. But here's what you need to remember. There isn't going to be just one curve. It's going to come back. It's going to come back again. Until 60 to 70% of the human population has immunity, either due to recovering from infection or vaccination, this thing is going to keep going. And that's what flattening the curve is about. You want to stretch that process out over as long a time period as possible, because you don't want the number of cases to spike at any one time. It's not really right to ask a doctor, should we extend the lockdown? Because I'm not an expert on economics. I'm not an expert on policy. I can only tell you what we need to do for infection control.
Yes.
It takes a multidisciplinary team of experts to balance infection control with the economics, of a lockdown and the human suffering.
That's correct. Dr. Swapneil Parekh, thank you so much for giving us your time and those very special graphs as well, which will help a lot of viewers understand that it's not just about one graph. Perhaps we have to ensure that even if the lockdown is reduced, there could be another graph and another curve that's coming in. Thank you so much, Dr. Parekh, as always, for your views as well. So we'll see what precisely happens by May 6th.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.